Good evening. Welcome to League of Women Voters Presents. I'm Jim Robertson, and our topic tonight are the healthcare exchanges or marketplaces that are part of the Affordable Care Act. The Patient Protection and Affordable Care Act, also known as Obamacare, has been cloaked in controversy since it was signed into law in 2010. 75% of the Act's provisions in the interim have gone into effect, and those include the elimination of pre-existing conditions as a barrier for health coverage, and the inclusion of dependents up to 26 years old on their parents' health policies. Those are the ones we've heard about, and there are many others that have also gone into effect. Now, the October 1st, a centerpiece of the act went into effect, and that's the healthcare marketplaces. My guest tonight is Aaron Swaney with the Family Medical Center?
Family Health Center.
Health Center, I'm sorry. Aaron, one of the terms we have heard and we are beginning to learn about is the Navigator. What you do is similar to what the Navigators with the Healthcare Act do, right?
Yeah, so technically I'm a certified application counselor, but the difference between a certified application counselor and a navigator is simply where they get their funding from. I mean, we go through the same training and we're expected to carry out the same roles, and especially here in Columbia, they're all the same.
And what is your role?
My role is to, first of all, do outreach to help people learn about the marketplace, but then to also sit down with people one-on-one and walk them through an application process so that they can find out what their options are and potentially enroll in some coverage.
Mm-hmm. We promised our viewers tonight that we would give them sort of a short course on enrolling for healthcare coverage, and I'm going to let you take it from here and kind of go through that with us.
Yeah, well, the main place to do that is the healthcare.gov website. It's kind of like an Orbitz or a Kayak, so a place where you go and buy things. And at the healthcare.gov website, you fill out an application, and then it will tell you it will give you a list of plans that you can choose from, and it will tell you whether or not you qualify for tax credits or cost sharing reductions that can help reduce the cost of your coverage. One of the big things that some people don't know about the marketplace is that it's a place to compare and buy private insurance plans. It's set up by the government, but all the plans purchased through there are run by private insurance companies.
So that's what people are commonly referring to as government health insurance. It's actually private health insurance.
It is.
And the government's role is to subsidize at various income levels the purchase of that.
Yeah, it's the government facilitates the marketplace, and then it subsidizes plans that are purchased on the marketplace for people between 100 and 400% of the federal poverty level. So for an individual, that would be around $11,000 to around $45,000, and for a family of four, that would be anywhere between like $23,000 up to $95,000.
Do we know how many people in Boone County would potentially qualify for those subsidies?
Around 10,000, actually. It's a pretty large number. There's an estimated 19,000 uninsured residents in Boone County, and 9,000 of them fall below, that would have qualified for Medicaid expansion had we decided to expand it. So those other 10,000 are all people under the age of 65 that would qualify for subsidies.
Well, take us through some of the steps to enroll in the...
Well, the first thing is to know what you're going to need to have. The first thing is an email account. Because it's done through an online system, they use email to communicate. And this is beneficial because it allows the process to be sped up a lot instead of having to wait for snail mail and getting that snail mail processed. So the first thing to have is an email account. For those people that don't have an email account set up, you can go to the library and get help with that. Hotmail is often the best one because you don't have to provide a phone number for them. And then once you've got an email account set up and you're ready to go through the application process, you're going to need basic personally identifying information. So that's your name, your birthday. You'll need to know your social security number, and then you'll need to know that for all the people that you'll be applying for coverage for. So if you're a mother and you're applying for your whole family, you'll need to know everybody's names, birthdays, and social security numbers. And then you'll also need to know income information for the whole family, because the income information is how they determine whether or not you qualify for tax credits and how much you will get out of those tax credits. And on top of that, you also need to know if you do currently have coverage, you'll need to know those policy numbers. And if you have an employer that offers coverage, even if you have chosen to opt out of it, you'll need to know the details of that coverage. And there's actually there's a tool on the healthcare.gov website that you can get and take to your employer. Although I'm pretty sure that all employers were required to provide this information.
So the employer should be familiar with what the employee needs to have.
Yes. So ideally, we would have had some slides to go through here, but instead we're going to I'm going to talk through a video on somebody doing a model application. So this is the front page of the website. The first step is to set up an account. So they go to get insurance, and then on the next page they select their state. This one's in Delaware. This is just the one set up by the Center for Medicare and Medicaid Services. Click Create Account. And then you have to enter that personally identifying information, or the basic parts of it. So your name, your email address, so that they can communicate with you. And then, like anything, you have to create a username. And this is going to be one of the hard things for people. Whenever you create a username and the password, you want to make sure you write it down and keep it somewhere safe where you'll remember it. And then, like pretty much any online account, they're having you create security questions. And these ones, honestly, are a little different from the standard set of security questions. I felt they're kind of they're a little different. So once again, you want to write down the answers to those and keep them somewhere safe. That way you know them whenever you need them in the future. So then you create an account. They send an email to you, and you have to click a link that verifies it, and it takes you back to this page. Success. So then you click to apply. And this demo goes through it really quickly, but generally, when you get to a green button, that's kind of your goal, is to get to those big green buttons that say begin and next. There's a privacy statement. One of the big issues about the application is that there's a lot of personally identifying information, and so they want to keep it safe. So that's why they ask so many security questions, and that's also why you want to make sure you're going, if you are getting assistance, you want to go through a verified channel. You don't want to just ask Joe Schmo to help you with an application. You want to go to the website, you want to go to the call center, or go to an in-person assister somewhere in Columbia. So you've entered some more basic information, your address, and Miles is getting insurance for his whole family. Who knows if they're there at the computer with him. And his family consists of 3 people, I think. It's him, his wife, and his son. So you can use that to change the number of people. Save and continue. So he's the first person. He enters his date of birth. The next person is his wife. So enters her name, her date of birth, and then any children. And you can add as many children as you have. Whether it's none or 20.
And you don't have to have any documentation to present to somebody.
No, and that's one of the nice things about the online application system, is that it verifies all the information that you've entered with the Social Security Administration and the IRS. So your income gets verified, your social security number gets verified. If you're a legal immigrant, it verifies your documentation number with the IMS. So then Miles is going through and entering his basic information. It's his social security number. Says he has the same name as his social security card. He's a U.S. citizen. And one of the other nice things about the online application is that it's dynamic. So like on that one, he answered yes to he is a U.S. citizen or national. And so if he had answered no, it would have taken him to a different route. But because he answered yes, this is this is the trail he's going down. And a lot of this demographic information is, I think, just kind of for record keeping. The only things that can change your the cost of your premiums are your age, the number of people enrolling on your plan, and whether or not you smoke. So pre-existing conditions that used to hike up costs a lot are no longer an issue. But smoking does definitely hike up the cost.
That's just an honor question then, huh?
Yeah, well, I mean, it is initially, but I think that if you fudge that and then it becomes clear later that you are a regular smoker, then you could probably get in some trouble for that. So it's kind of a process. You have to go through each person and enter all this information. And this simulation is just flying through it. So it's really, the application is expected to take about an hour to 3 hours, depending on how many people you're doing and how many issues you have getting the information.
If I feel confident, I can do this alone.
Yeah, it's set up so that you can do it alone. That's the idea. But I would say that if you have any questions, don't try to say, oh no, I can figure this out. Go ask questions, because especially for people who haven't had health insurance before, there's a lot of issues here in terms of costs, like premiums, deductibles, co-payments, that can be really confusing. And talking to somebody who knows their way around that territory, whether it's online through this chat function, or over the phone through the call center, or like an in-person assister like a Navigator or a certified application counselor, even an agent or broker. That's really important, because it's a big decision. It's a big financial and decision, and it's something that you want to make sure you're getting the right information. So then once you enter all that personally identifying information, then you have to go and add income information for everybody in the household that's bringing in income. You can enter it if you saw that. You can say, if you don't know what you make in a year, but you know what your hourly rate is, you can enter it that way. You can enter it weekly, bi-weekly, monthly, because not everybody does know what their annual income is.
And that's total household income?
Well, so that was just for Miles, and then they're going to ask the same for Lisa, and then they're going to go ask the same for Nico.
Gotcha. Is the cost of insurance based on the household income?
No, well, sort of. So the cost of the premium or the insurance is going to be determined by age, number of people enrolling, whether or not you smoke. But then the amount of subsidies, or the amount that you'll get in tax credits and potentially cost sharing reductions, that's what's determined by income. Yeah. And people lower in that 100 to 400% scale will get a larger subsidy than people that are closer to the top of that.
And those subsidies are paid directly to the insurer?
There are two options. I think that most people are going to choose the one where it's paid directly to the insurer, but you can also choose to take it just as a tax credit at the end of the year, like a normal tax credit, in kind of one big lump sum, but then you'll have to pay the full price of the premium every month.
Right.
And I think a lot of people would rather get the reduction in premium.
Right.
So then after you go through the income, they ask about whether you already have coverage and whether you are offered coverage through your job. There are some rules about that. If you're offered affordable coverage through your job, then you actually don't qualify for the tax credits because they want you to, accept the employer.
And who defines affordable?
Affordable is defined as whether the total cost of your premiums over a year would be 9.5% of your annual income. Mm-hmm. So if it's below that number, then it's affordable, and if it's above that, it's not. But it's kind of tricky when you have a family. So if I'm head of household and I'm offered single person coverage that does meet that threshold, then that's considered affordable. And my family actually can't qualify for tax credits to buy them plans, even if I'm getting that employer coverage. But they're also likely going to be exempt from the requirement to the individual mandate, the requirement to carry health insurance. So, really, I don't think I can stress this enough. If you don't have insurance coverage or you're not really sure where your coverage is, go ask questions. So they finally made it through all the information. They double check everything. So you have to go back, read through, make sure everything's right. You don't want to have a number screwed up somewhere. And then eventually they'll click submit, and the verification process is supposed to take not that long. The estimates run between nearly instantaneous to an hour at most, because it's all done electronically. So it should be a pretty quick process. Whereas if you did this via mail, you'd have a few days for the mail to travel, then you'd have 1 to 3 weeks of processing, mail it back, you sign some more stuff, you mail that back, they do more processing and mail it back to you again.
So who does the verification? What agency?
Well, so through the website, the IRS verifies your income, and Social Security Administration verifies your Social Security number. I know that I want to say Homeland Security verifies something. I can't remember all the exact details.
Status.
Yeah. And so when you submit this application, you're saying that this is accurate information, and this doesn't say that you're definitely going to buy health insurance through this. This is just gives you first an eligibility determination on whether you're eligible for Medicaid. And so, if we were in a state that expanded Medicaid and they were below 138% of the federal poverty level, then they would qualify for Medicaid, and they would be able to sign up for that.
With the same application?
With this same application. It would get kind of routed over to the Family Support Division of that state, but you don't have to go through a second application. I think in this example, Nico is eligible for CHIP. So CHIP is kind of a supplement to Medicaid to help expand Medicaid up to a higher income level for children.
And that's a federal program?
No, Medicaid is always a state-run program.
Okay, and CHIP is also?
CHIP, yeah. Those are both state-run programs. And so this is sort of what these, this is a quick run-through of how this comparison is going to look. There's there's a lot of different types of plans. In Missouri, we have bronze, silver, and gold plans. Basically, the short version of those is that bronze plans have lower premiums and higher deductibles generally. So you'll have to pay less per month, but you might have higher out-of-pocket costs. So when you go into the doctor, you might have to pay more. Whereas gold plans have higher premiums, but lower deductibles and lower co-payments. So, somebody who's banking on not going to the doctor ever might want to get a bronze plan, but somebody who knows they're going to go to the doctor a lot and they're going to use that deductible might want to go for a gold plan. And when you're getting a plan, it's really important to consider those costs, but also, if you have providers that you already see, a doctor that you want to stick with, the insurance companies are required to provide details on whether providers are in that network, which makes seeing that doctor cheaper. And also, if you're on any prescriptions that you need to continue to take, they will provide what's called a formulary. It's just a list of prescriptions that they cover in their plan.
Now that the list of providers and medications is automatically forwarded to you from the insurance.
Yeah, it should be in this comparison. And there was a details button there that should provide.
So it'll have their networks online.
Yes. And so it showed them what they were qualified for in terms of tax credits, and then they enrolled in a plan. So that was a really, really quick rush run through.
Yeah,
but
I can't imagine getting through the application that quickly.
No, I mean, the estimate is that it'll be somewhere between an hour and 3 hours.
They had some glitches since October 1st.
Yeah.
With the website. Have you experienced problems getting people through the?
Oh yeah, and a lot of people have. Fortunately, the good news is that some people have gotten through. So it really does seem like it's sort of a volume problem, and especially because, like before October 1st, I went and created an account for myself, just to see what it was like. And now people are having trouble creating an account, and that's because they had 7.5 million hits last week for a website that pings information from the Social Security Administration and the IRS to verify all this information. And so it's
very complex.
Yeah, it's extremely complex, and it's also very secure, and that's a good thing. And I'm confident that within a couple of weeks it will be up and running fully.
Well, what's coming up that our viewers need to know about?
Well, I think for the marketplace in general, the big thing to know is that there's this open enrollment period. And so open enrollment lasts for 6 months between October 1st, which was last Monday, and March 31st of 2014. And between that time, you are able to enroll in any plan that you want. But after that period, you have to have something happen. It's called a qualifying life event. So you have to get pregnant or lose your job or something to be able to sign up for a marketplace plan again. Coverage would start at the earliest in January 1st. So it's not, even though we've had these glitches this week, it's not like there's a huge rush. It's October 1st is a big day, but really I think the more important day is December 15th. So if you want your coverage to start on January 1st, then you need to enroll by December 15th, and it's 2 months away. So we have some time here.
Don't panic yet.
Yeah. And at least from my perspective, also another big date is October 30th. On that night, I'm going to be hosting with the League of Women Voters a panel question and answer session at the library, and hopefully we'll go over more of the kind of rules and nitty-gritty of the marketplace and the Affordable Care Act. Dr. Karen Edison, who's the director of MU's Center for Health Policy, will be on the panel, as will Mary Timmel, who's from the Small Business Majority. She'll be able to answer questions that people have about the business side or the employer side of the Affordable Care Act. And hopefully that'll be more than just this is how you use the website.
Right. Oh, good. Well, it's it seems very complex right now. Hopefully a year from now, people will be more familiar with it, and will be able to navigate it and like it.
Yeah, and yeah, it is definitely a complex issue and a complex website, but it's also a really exciting time because there are a lot of people that I've talked to that I know are going to be able to get more affordable coverage than they've had before, or affordable coverage for the first time. You know, at Family Health Center, we see a lot of uninsured patients, and that's.
Yeah, now you mentioned the event coming up with the league. What other kind of outreach do you?
Well, between me and the other Navigator groups that are Central Missouri Community Action, the Central Missouri Area Agency on Aging, and Primaris Business Solutions, we kind of do group presentations to small groups. So, you know, any group that would want us to come talk, we'd be happy to. And we're also planning some enrollment fairs at the library. I think that the first one of those is going to be on the 23rd or the 25th. So I don't want to put my foot in my mouth on that one, but.
So if you're interested out there in having an explanation and some counseling there in Swaney at the Family Health Center, contact him and he will fix you up. Well, thank you, Aaron. It's really
Welcome.
Interesting and valuable, I think, for all of us to hear this. And hopefully our viewers have learned something they can use tonight. Thanks for joining us. It's time we go. Until next time, I'm Jim Robertson.